Very good evening, guys. How are you all? So, how is your preparation going on? So, I hope you're all doing well. So, welcome to the platform of eGurukul. I am Dr Ramyashree. I teach obstetrics and gynecology. Right? So, I have Monica asking me to teach the conjunctiva, cornea, and cataract. So, Monica, that is little out of my. I think I definitely forgot everything. So, Neha ma'am can help you on that. So today I have kept some beautifully framed questions for all of you. And not only that, I have also decided that we will daily have this MCQ discussion coming forward. So May 8th, you are having the INE CET. So I try to keep questions which might come in the INE CET. And post INE CET, we have the next Neet PG. I know this is the most crucial time. I tell you guys, this is the most crucial time. And this is a time period where it is not like you have to study something. It's not like you have to read that, read this, read that, nothing. This is the time where you have to keep your mental balance. You have to keep calm. You have to keep composed. This is the time where you have to keep yourself in a control so that you can give a best output. Have you ever observed that there is some question which in exam hall you couldn't answer, but when you came out, the same question you read it again. Oh, I knew this and I knew the answer, but I couldn't answer in the exam hall. So that is because of the anxiety. So this anxiety can, kill everything. So trust yourself. I know you all have wonderfully prepared. So don't break that. That confidence which you have on yourself. Don't take don't take anything negative into your brain. Just trust yourself and go forward. I tell you, you're going to do wonders. And from my side, the one thing what we can do is, this is a time where we have to practice more and more and more MCQs. And I want you to tell, yes, whatever we have discussed has come in the exam. So that will be the motto. So a small plan for us is, once you come back from your INE CET, 9, 10, 11, we are going to have daily 9 p.m. on the same platform of YouTube. We are going to discuss the MCQs. So that's going to be a practice, and I want all of you to actively participate when we are discussing the MCQs, so that when you go back, it will be a cakewalk for you for practicing the MCQs. And any questions or any queries, feel free to ask me during this session, guys. So let's start with the first question. So I try to keep those questions which my sixth sense is telling might come in our exam. Okay. So first question, what is the fixative used in taking liquid-based cytology? So many times you get a question, what is the fixative used in a Pap smear? So I changed this little bit and I'm asking you here, what is the fixative which you use in taking the liquid-based cytology? Thank you, Nasira, and I believe that you will be my junior in near time. So all my blessings to you and prayers for you to get your dream branch. Okay, see, this is one more very, very big problem which we have during our practice, that is silly mistakes. Your answer would have been 95% ethyl alcohol if my question would have been, what is the fixative used in taking Pap smear? I already told you, usually everywhere they ask Pap smear. So I have changed it little. I didn't ask you what is the fixative for Pap smear. Here I have asked you what is the fixative for liquid based cytology, not for Pap smear, guys. Sure, Saurav, I'll try to do that for you. So remember guys, the fixative for Pap smear is 95% ethyl alcohol. The fixative for Pap smear is 95% ethyl alcohol, and the fixative for liquid based cytology is methanol. The fixative for liquid based cytology is methanol. Right? So remember, it is the fixative for Pap smear is 95% ethyl alcohol, whereas the fixative for liquid based cytology is methanol. Okay? So the answer here is D, methanol. D, methanol. Sure, Ganesh, even that is a good book. You can follow the Hacker and More also for your text as a textbook if you are comfortable with it. See, you can follow any book whichever you feel comfortable. Only thing is that your concepts should build up well. That's all. Okay. So I tried to keep some images here. So anybody can guess what is this image. So we'll do one easy question, one little difficult, because I'm trying to train you for your exam, right? So can you tell me what is this image? So these are the epithelial cells, vaginal epithelial cells. So what do you think this is? So you are seeing around the nucleus halo. So you are going to get a lot of integrated questions like this. So this is an integrated question of path and OBS. So here you are seeing a perinuclear halo. So this is a normal epithelial, normal superficial cells. This is a normal superficial cell. So can you see the nucleus here? The nucleus ke around you are having the cytoplasm, pink color cytoplasm. But observe this cell. In this cell, around the nucleus, you are seeing a halo, a white halo. So what is this? So this to the side is the superficial cell, which is a normal superficial cell. When you have in the superficial cell or the intermediate cell, in any of the cell, when you see a perinuclear halo, that is called as coilocyte. That is called as coilocyte. Okay. Excellent, Kaustubh. Very, very good, Kaustubh. So these cells, superficial cells, are seen abundant in proliferative phase. Right? So this is a coilocyte. So this statement is wrong. So superficial cells are under the influence of estrogen. So superficial cells are abundant in proliferative phase. What are the cells which are abundant in secretory phase, guys? So superficial cells will be pink and polygonal. So they'll be pink and polygonal with a small nucleus and plenty of the cytoplasm. So what are the cells which are abundant in secretory phase? The cells which are abundant in secretory phase is intermediate cells. Intermediate cells are abundant in secretory phase because intermediate cells are under the influence of progesterone. So these cells, coilocytes, are the HPV infected cells. So these cells are seen in patients with HPV infection is an absolutely correct statement. So the answer here is C. What are the cells which are seen in menopausal women? So the cells which are seen in menopausal women are basal and parabasal cells. Basal and parabasal cells. So how do you identify basal or parabasal cells? So basal or parabasal cells are round to oval and they are blue colored. And they are having a big nucleus and a very less cytoplasm. They have a big nucleus and very less cytoplasm. So basal or parabasal cells में you have a big nucleus and very less cytoplasm. Okay, so what superficial cells are dependent on estrogen and they are present in proliferative phase. Secretory cell phase may you mainly have the intermediate cells. Intermediate cells are blue and polygonal, which are under the influence of progesterone. Parabasal and basal cell are under no hormonal influence and they are seen in menopause and puberty. So the cell which you are seeing here in the picture is a coilocyte because it has a perinuclear halo, and whenever there is a HPV infected cell, you call it as a coilocyte. Right? I hope all of you are clear with the cells. So I'm going to show you some more images of the related to Pap smear itself in this session. So we are going to target little more on the cervical cancer, cervical images here. Okay. So what are the changes which you are observing in a coilocyte? As I told you, now it is an era of an integration. You might get an integrated questions. So here we have the path and ob integrated question. So in the coilocyte, you have a bigger nucleus, less cytoplasm. So slowly they are undergoing the metaplastic changes, right? So the cytoplasm will become less and mitotic figures and nuclear atypia, all this will start. Okay, and you will have a perinuclear halo. Okay, now this is an easy question. The below instrument are used for which of the following procedure? The below instrument are used for which of the following procedure? So what do you think this is? So I've also got a lot of requests for prolapse. So today we have also posted one video on genital prolapse case presentation where I've also discussed about POPQ quantification. So have a look on that also, guys. Very good. So this is nothing but this is used for the Pap smear. Who can name what are the two things which are seen in this? So one we see so this is nothing but the iris spatula. Does anybody know the name of this jar, guys? Does anybody know the name of this jar? So when I was a postgraduate, we used to have the Ayamma bringing only 4, 5 or 6, 7 jars. She used to never bring lot of jars and keep there. Because she used to tell they're drinking the 95% ethyl alcohol is being stolen. So she used to bring only 4, 5 jars or 6, 7 jars. So these are called as Copland jar. This is called Copland jar. This is called Copland jar, guys. Very good, Rana. Excellent. So this is called Copland jar. So iris spatula and Copland jar both are used in Pap smear. So this sure path vial and this cytobrush, this sure path vial and this cytobrush, this is used for liquid based cytology, guys. This is used for liquid based cytology, which is more superior to Pap smear. So this sure path vial and liquid based and this cytobrush is used in liquid based cytology. So this is called as rover cytobrush. This is called as rover cytobrush. Okay. So this is the iris spatula, which takes the smear from the ectocervix, and this is the cytobrush which takes the smear from the endocervix. So the previous question which I have shown you was the INI-CET ka question only. I have kept all the PYQs from the INI-CET itself. See, 80% you would tend to get the PYQs, right? So the topic will remain the same, more than the question. So last June session mein they have asked the iris spatula, so you can also get the liquid based cytology brush also. So liquid based cytology brush ka what is the speciality is, this can take the smear from both ectocervix as well as endocervix. It is a single brush which takes the smear from both ectocervix as well as endocervix. So this is the rover's cytobrush. So this part will take the smear from the ectocervix, whereas this part will take the smear from the endocervix. Okay. So this was also your INECET question. So now post you answer this question, we will discuss how do we do Pap smear, how do we do liquid based cytology, everything about the screening methods we'll be discussing. Arrange the steps of Pap smear testing in a correct sequence. Take the sample, fix the smear, make a smear on a slide, retract the posterior vaginal wall. So first, this is the rovers, guys. I'll just zoom it, Saurabh, so that you can see it better. So this is the rovers. Can you see it is rovers written also? It is from the company of the rovers. So this is the rovers cytobresh. So this part will take the smear from the endocervix. This outer part will take the smear from the ectocervix. Okay. Right now, let us go back. So I have an answer here 4123 or 4123. Okay. So retract the posterior vaginal wall. Excellent. The first thing what you do is retract the posterior vaginal wall. Can you apply, so before you insert I prefer to use Cusco speculum here. Bivalve self-retaining. Right. Okay. Anyway, they have told posterior vaginal wall retractor. You can use the posterior vaginal wall sim speculum. Okay. Can I use gel before putting the speculum inside? Can I use betadine or can I use gel before I put the speculum or before I put the speculum inside the vagina? So you'll never put the speculum, you'll never put the gel or the betadine. You should never put the gel or the betadine, because what will happen? That will change your findings. So you should not put any gel or any betadine. So retract the posterior vaginal wall, correct. Then you take the sample, very good. So after the 4, it is 1. Then what do you do? So after you take the sample, what will be your next step? So your next step will be, so once you have taken the sample, you have to smear it on the slide. You have to smear it on the slide. So 4 is correct. So you track the posterior vaginal wall. Then you take the sample. Then you have to make the smear on a slide. So 4, 1, 3 and followed by that you will fix the smear. So then you will dip it in the fixative. So see here, this is the Pap smear ka hum kaise kar rahe karke. So in Pap smear, you are taking the sample from you're taking the liquid based cytology as well as in Pap smear, you are taking from the iris spatula and cytobresh. So you're going to smear it on the slide. And then you're going to put it in the fixative. So what was the fixative for our Pap smear? So fixative for the Pap smear is 95% ethyl alcohol. 95% ethyl alcohol. Then you are going to air dry it. And then you're going to examine it. But during this entire process, you're going to lose 80% of the cells. So you can lose 80% of the cells in this entire process. That is why it is not very ideal Pap smear ki. It is not very good. Okay. So coming to the liquid based cytology test. So here the cytobresh will take the smear from both ectocervix and endocervix. After that, you're going to break it. You're not going to smear it on any slide. So you can break this. So you're going to break this and dip it into the collection vial. You're going to dip it in the collection vial which contains the fixative of methanol. So you're going to dip it in the collection vial which contains the fixative of methanol. Once you dip it inside, you send to the lab. Then the fixative with the cells is centrifuged. So when you centrifuge, you remove the debris, you remove the dead cells, blood, mucus, and then you're going to get a thin layer of monoprep of only cervical epithelial cells. So that is why this has a greater number of cells to examine. So sample will be adequate when you use liquid-based cytology test. So in comparison with Pap smear and liquid-based cytology, which is more better test? Which is more better test? Is Pap smear better or liquid-based cytology better? So obviously the liquid-based cytology is better than Pap smear. Obviously liquid-based cytology is better than Pap smear. So now there are some single liners which you have to learn here. So we are going to learn some single liners here. So what should be the timing of your Pap smear? What should be the timing of Pap smear or liquid-based cytology? So timing for Pap smear or liquid-based cytology should be around the ovulation. Around ovulation. So you should do it around 12th to 14th day. Why? Which is the first site of HPV infection? See, everything is conceptual, guys. That's why I always tell, remember the concepts. So which is the first site of HPV infection? So the first site of HPV infection is a transformation zone. And we all know that transformation zone is a dynamic zone. So it keeps moving inside and outside. Whenever you have high levels of estrogen, the transformation zone will come out. So around the ovulation, around 12 to 14 days, you have high levels of estrogen. So that is the time where this transformation zone will be outside. So that is why you have to perform the Pap smear or LBC around the time of ovulation. So I hope you all understood the concept here, as transformation zone will be outside. So your target should to pick up the cells from the transformation zone, because that is the first site of the cancer, right? Next, abstinence prior to the test. So around at least 3 days of abstinence prior to test. No douching or gel when you are doing this test. While you're performing this test. Okay, so these are some of the prerequisites which you should to take. Next important point is, so there are different screening methods. One of the question which they can ask you is, what is the screening method of choice in India? What is the screening method of choice in India? Now I'm eagerly waiting to see the answer from you all. Very good, Nasira. Excellent, new medico. Very good, Ganesh and Padmavati, for answering it correct. Excellent, guys. So what is the screening method of choice in India? Now this is a mistake which we do. So the screening method of choice in low resource setting, or in countries like where it's a developing countries, the screening method of choice is visual inspection under acetic acid. See, Pap smear may, you have to do a smear, you have to put it on the slide, you have to send to pathology lab. Does every rural state or rural village or district, or small mandals, do all of them have lab and all? No, but you all can diagnose the CA cervix with visual inspection of under acetic acid. So you put acetic acid is available in every home. It's a vinegar. Put the vinegar in on the cervix, and you can train midwives or dais also to do this. So you put the vinegar or acetic acid, and then you examine the cervix. If you feel it is abnormal or if there's a patch, you can refer her to the higher center. If it is normal, you can tell, bhai acha hai, go back home. So with VIA, we are able to downstage the disease in India. So that is why this is the screening method of choice in where we have low resource setting. It's not Pap smear, it is VIA. So even one more question which has come is, which is the most cost effective screening method? So most cost effective screening method is also VIA. And which is the best screening method? So best screening method with highest detection rate is HPV DNA testing. We not only diagnose only cancer with screening, right? You can also pick up many organisms on Pap smear. So now I'm going to show you all the images of all the organisms which can be picked up on a Pap smear. Okay. So what all infections can be picked up on Pap smear? Any idea? Anybody would like to answer? What all we can pick up on Pap smear? So you can pick up Trichomonas. This also has been asked as a question, guys. So you can pick up Trichomonas. You can pick up fungal organisms like Candida. You can pick up Bacterial Vaginosis. You can pick up Actinomyces. You can look for the cellular changes with HPV virus, herpes simplex virus, and you can also do the cellular changes with the cytomegalo. You can also detect the cellular changes consistent with cytomegalovirus. So you can pick up the Trichomonas, you can pick up the fungal organisms like Candida. You can see the shift in the flora, bacterial vaginosis, actinomyces, herpes, and cytomegalo. What you cannot pick up has been asked as an MCQ. Gonococci cannot be picked up because it's an intracellular organism, right? Gonococci cannot be picked up on a Pap smear. Yeah, chlamydia, all those also, but these are the organisms which can be picked up. Okay, now I'll show you the images. You have to tell which organism is that. Spotter type. Okay. So who can tell me the first picture? What do you think? What I'm showing you? Which picture is this? So we are trying to target some image-based questions in this session. What do you think is this? So what do you think this image is? Very good. Pear-shaped flagellus. This is nothing but the Trichomonas. So pear-shaped flagellus, Trichomonas. Somebody tells Trichomonas, what should strike your brain is pear-shaped flagellated organism. It's a protozoa. It is a sexually transmitted disease. So you have to treat both the partners. Greenish discharge associated with itching. Strawberry, right? They have strawberry cervix and strawberry vagina. And what is the drug of choice, guys? So the drug of choice is metronidazole. The drug of choice is metronidazole. Right? Okay. Both the partners should be treated with metronidazole. Okay? Right. The next image. The second image, guys. Excellent. Very good, Priyanka. So, everywhere you have to remember that small clue. Matlab, only those points. Those are the things which they can ask us again and again. Okay, what is this image? Second image. So you have something like stick. Around that epithelial cells are wound around. So this is called as true, Saurav. I also miss giving you all chocolates, to be frank. I also miss giving chocolates, and I definitely miss those days, right? So what do you think this is next image is? So this is, now I told you before itself, key you should never go no. See, this is one common mistake I've already seen from students. That's the reason. See, one more thing which I always try to do is, I know common mistakes which students do. Please remember, gonococci cannot be picked up on Pap smear. Remember this. Gonococci cannot be picked up on Pap smear. Okay? Metronidazole should be avoided in the first trimester of pregnancy. So metronidazole should be avoided in the first trimester of pregnancy, right? So what is this? So this is the candidiasis. So this is the candidiasis. So this is called sheikh kebab appearance. This is called sheikh kebab appearance. So this is called sheikh kebab appearance. So here you have the epithelial cells wound around the pseudo hyphae. So the epithelial cells are wound around the pseudo hyphae. This is called candida. This is nothing but the Candida albicans, and this is called sheikh kebab because it is looking like a sheikh kebab. है ना? So what are the key points which should strike your brain? So Candida is associated with lot of food. Yeah, it is looking like sheikh kebab. It produces paneer like discharge. Yeah, dahi like discharge, right? So so you have curdy white discharge or paneer like discharge, and there's lot of pruritus. So it is mainly seen in immunocompromised. This is the only organism which can grow in acidic pH. So that is why it is seen in pregnancy, because pregnancy mein pH is highly acidic, right? And the drug of choice is fluconazole. The drug of choice is fluconazole. Okay, let us see the next. Very good, Nasira, correct. Right, what is the next image, guys? What is the next image? Please read all the vaginitis perfectly and go. One question from vaginitis is pakka. Okay. So what is this? So this you are observing here, these are the bacteria which are attached to the vaginal epithelial cell. So to the vaginal epithelial cell there are small bacteria. So it is the cocobacilli which are adherent to the vaginal epithelial cells. So these are called as clue cells. These are called as clue cells. Yes, clue cells are seen in bacterial vaginosis. Now one more point, guys. Clue cells can be seen even in a normal physiologically also you can see. But when you see more number of clue cells and less lactobacilli, then you call it as bacterial vaginosis. If you see clue cells, it is not like always your answer should go for bacterial vaginosis. Normally also we can see some amount of clue cells. Okay. So bacterial vaginosis is not due to some organism particularly causing this disease, but it is due to the alteration of microflora, where the good bacteria or the lactobacillus is decreasing, and where the bad bacteria or Gardnerella, Prevotella, Mobilingus, Ureaplasma ureolyticum, Peptostreptococcus, all these are increasing, right? What is a drug of? Yes, you should all know the Amsel's criteria. Yes, I have put amenorrhea questions also coming. They are coming. Don't worry. Okay, what is Amsel's criteria? Please quickly tell me the Amsel's criteria. So 3 out of 4 should be present. So what do we have in the Amsel's criteria? So in the Amsel's criteria, we have pH should be more than 4.5. Dirty white or grayish white discharge. Clue cells should be seen. And when you put 10% KOH, you will have fishy odor. You will have fishy odor due to release of amines and putrescine. Due to release of amines and putrescine. So when you apply 10% KOH, when you apply 10% KOH, you will see fishy odor due to release of amines or putrescine. Okay, and this is called as whiff test. This is called as whiff test. So the drug of choice even for bacterial vaginosis is metronidazole itself. Metronidazole, right? So probiotics are always good, but they are little on an expensive side. So usually we tell them to take from 1 to 3 months. Okay. Yeah, I think this picture is having the name on it. If you have not seen, please tell me what is the next picture which you are seeing. So what is this next picture which you are seeing here? So from the epithelial cell, you're seeing the tangled filamentous organisms coming out. So this is called as cotton ball appearance, yeah, cotton wool appearance, or sun ray appearance also you can call it as. So many students actually confuse with clue cell. This is the clue cell. This is So you have already seen means yes, I am going to write it as directly. So this is Actinomyces. So we have done all the quick recap of all the important images which they can ask you in the exam, guys. So this is the Actinomyces. Actinomyces is seen with whom? Is associated with? It is associated with IUCD users. All are very smart and quick. Very good. So this organism is associated with IUCD users, right? So what are the four images? This is the Trichomonas. This is sheikh kebab candidiasis. This is clue cell, and this is Actinomyces. So now I take Nasira, I have already done specially because you have mentioned it. All the placental images ka video I have done. They are going to put it on the YouTube very soon. So before exam itself, obviously. So you can go through it. Right, I have one more question, that is, instead of asking which vaginitis itching is seen, I would like to ask you in which vaginitis itching is not seen. Yes, this is Actinomyces israeli. So in which vaginitis itching is not seen? So Trichomonas and Candidiasis, both you have itching. Trichomonas vaginitis and Candidiasis, both you have itching. Bacterial vaginosis. In bacterial vaginosis, there is no itching. In bacterial vaginosis, you have no itching. In bacterial vaginosis, there is no inflammation. So that is why the name also is vaginosis. It is not vaginitis. Okay. Very good. Excellent. Okay, so one question. So you can tend to get some clinical questions like this. Okay, let us try to solve this question. And this, I feel, this pattern or this concept is one favorite, and I am expecting this to come in the exam. Somehow I am feeling one cervical cancer से एक question, एक vaginitis से एक question, एक ये question, and एक adnexal mass. These might, sixth sense coming in brain ki shayad it should come, no, so that it will be helpful for you all, because we have discussed. A 48-year-old lady who is para 1 attends the gynecology clinic for irregular and erratic bleeding occurring for past 6 months. So whenever you are reading the question of clinical, what are the things which should strike your brain while you are reading is age of the patient. 48. ठीक है. I don't want to save her uterus. That is there in my brain now. Parity is important. She is only para 1. Okay. And she has come to you with irregular bleeding from last 6 months. So whenever there is 48-year-old coming to you with irregular bleeding, actually by 48 years, what do you expect the patient should go for? You expect the patient should go for menopause. But this patient is still bleeding. So very good, Priyanka. So you are expecting this patient can have endometrial hyperplasia or endometrial cancer. So whenever you have irregular bleeding or postmenopausal bleeding, what should be your first investigation? Your first investigation, this also can be asked as an MCQ, is transvaginal sonography. So they have already done ultrasound here and they have seen endometrial thickness of 14 mm. So this is more only, right? Her LH is 4 and FSH is 6. What is the appropriate step? I appreciate all of you have answered it correct, that your next step should be going for Pip-A endometrial sampling because you want to rule out endometrial hyperplasias and endometrial cancers. Now my next question to you is, by her LH and FSH, is she menopausal or is she premenopausal? Is she menopausal or is she premenopausal? Yes, I am expecting you people to answer. Is she menopausal or premenopausal? Very good. She is not menopausal. She is premenopausal. When do you call patient is in menopause? When FSH and LH are more than 40. Then you can call it as menopausal. So she is premenopausal. So that is why you're going, and as she is a Paris lady, you're going for Pip-A endometrial sampling because this is the investigation of choice. Very good, Sai Charan. Excellent. Because this is the investigation of choice. Now let me change the question a little. Try to answer it again. If I change this question as, who is nulliparous? Then what would have been your answer? Same question, but I've changed the para 1 to nulliparous now. Now tell me what will be your answer. So if somebody is nulliparous, then what will be your answer? I am going to give a gap here because I really want you people to answer this. See, when there is and I'll followed by this, I'll tell you the flow chart key whenever you have this type of questions, how to answer. Okay. So will the answer change or will answer not change? Try to think and answer. Alex, I'm not expecting her to get pregnant at the age of 48 years. This is like, I don't know, all of you are answering a same silly mistake. मैंने बहुत बार कहा, I always tell India is a fertile land, but don't think India to be so much fertile कि 48, 70, 60 maybe बच्चा, right? So the only reason why I have changed it to nulliparous is, in nulliparous the os will be pinpoint. In nulliparous the os will be pinpoint. So when you have a pinpoint os, you cannot do Pip-A endometrial sampling. Pip-A endometrial sampling is more feasible when you have a multiparous os where the slit like. Because you are doing it as an office based procedure. So little cervix should be dilated if you want to put the Pip-A inside. So pinpoint os or nulliparous os mein you cannot put the Pip-A because here we are not doing any cervical dilatation. So then we directly jump and go for outpatient hysteroscopy and biopsy. Outpatient hysteroscopy and biopsy. Okay, so I see many of you have answered it correct. C will be the answer if the question would have been nulliparous. So this is how your answer can keep changing depending on your questions. So this practice is very important before you go to exam. And I have come back. We are going to resume this practice of MCQs before your exam. So come back, give your INI-CET. Then we are going to have a blast of MCQs so that we are prepared for our Neet PG as well. Okay. So now a quickly one. So those I'm going to do daily sessions like this every day 9 p.m. on the platform of DBMCI YouTube. 9, 10, 11, every day 9 p.m. Don't miss it, guys, and you're all being great participants. Continue the same. So now we are going to quickly discuss. So whenever there is an irregular bleeding in premenopausal or when you have postmenopausal bleeding what should be your next step? Your first step is transvaginal sonography to measure the endometrial thickness. If endometrial thickness in premenopausal patient is more than 12 mm or if endometrial thickness in postmenopausal women is more than 4 mm, your next step should be going for endometrial biopsy. So what is the investigation of choice for the endometrial biopsy? The investigation of choice for endometrial biopsy is office endometrial pipellae. Office endometrial pipellae. Okay. What is the gold standard for doing the endometrial biopsy? What is the gold standard for doing the endometrial biopsy? Again, a new point I am telling you, or the update I am telling you, fractional curettage is no more the gold standard, guys. You don't see the option of fractional curettage. We don't perform that anymore much. So the gold standard for endometrial biopsy or endometrial sampling is hysteroscopic DNC. Look inside and take the biopsy. Where else you will go directly for hysteroscopic DNC? So what are the conditions where you are going to go for directly? So please remember, fractional curettage is no more the gold standard. What is the gold standard now? Hysteroscopic DNC. Okay. If you have option of fractional curettage and if you don't have hysteroscopic DNC, go with fractional curettage. Fractional curettage means you are doing dilatation and curettage plus you are taking the endocervical curettage. Those both can be performed with hysteroscopic DNC also. You can look inside and then take the biopsy here, right? So where else you go for hysteroscopic DNC directly is when you have a pinpoint os, when you have a focal thickening. So when you have a focal thickening, you have to take a targeted biopsy. So that is why, very good Alex, when you have a localized thickening or the focal thickening, okay, and when you have when patient is on tamoxifen, and when you require to take a biopsy, you have to go for hysteroscopic DNC when patient is on tamoxifen therapy. Okay, so this type of question you can expect in your exam, and I am hoping that you all are perfect with this concept now. Okay, and one more 3 single liners I'll ask you here. What is the most common cause of postmenopausal bleeding? What is the most common cause of postmenopausal bleeding? Next. Yes, a very good question asked by Kaustubh. When a patient is on tamoxifen and presents to you with postmenopausal bleeding, then the cutoff of endometrial thickness is 8 mm, not 4 mm. Okay. Very good. Most common cause of postmenopausal bleeding is atrophic vaginitis or senile endometritis. Senile endometritis. Most common cancer causing PMB. Most common cancer causing PMB is CA cervix in India. Most common cancer causing PMB in developed countries. is endometrial cancer. Is endometrial cancer. Okay. ठीक है. And Kaustubh has asked that query. I hope you all understood that query also. So when should you do endometrial biopsy? What is the cutoff of the endometrial thickness? Cutoff of endometrial thickness when patient is on tamoxifen therapy is 8 mm, guys. Is 8 mm. And while doing biopsy, you will directly use hysteroscopic DNC. Next question. An antenatal USG of a 19 weeks pregnant female is given below. Identify the likely congenital abnormality. So, this is a USG picture. What are you seeing in this USG picture? I'll just zoom it so that you can see it more better. Very good. So, I already see the correct answers popping out. So, you have absent cranium here. You have absent cranium. So, absent cranium is seen with anencephaly. Absent cranium is seen with anencephaly. So, what will be the management for this patient, guys? What will be the management for this patient? So, even though she has come at 19 weeks or 29 weeks, whatever she comes to us, so her management will be, it is a substantial fetal anomaly, and according to the newer guidelines, there is no upper limit for the substantial fetal anomalies for termination. So, here we will go for termination of pregnancy. Yes, anencephaly, the diagnosis is called, you have another picture actually where they show the absent cranium and face like Mickey Mouse, no? So, that is called frog eye sign or Mickey Mouse sign. Frog eye sign or Mickey Mouse sign. And regarding the anencephaly, another point which we have is, it is the anomaly which can be detected as early as 10 weeks also. And it is best detected by 14 weeks itself. Normally, we pick up all the anomalies by 20 weeks, but this anomaly can be picked up even in the first trimester. Okay, it's a neural tube defect. Another very important topic where we can get question is regarding the Mullerian abnormalities. Guys, please revise Mullerian abnormalities also well. So, unicornuate uterus can be identified by which of the following investigation? So, try to answer this and then I'll ask some more questions. Right, so I hope, so all of you are ready for your exam. You all having INE CET. Please be confident. I know all of you, I am very similar to all the names which I am seeing you here in the chat box. So, not only you, everyone who are going for the exam, all the best, guys. Do well. Be positive. That's the most important. The coming up 3 to 4 days, just be calm, and whenever you're having a little panic attack or anxiety attack, the only thing which you can do is have a deep breathing. Just concentrate on your breath. That will make you a little cool. And please go little prior to the exam hall, and don't be that student who is holding the book till the last minute, till examiner is calling andar aajo. Don't do that. Go sit inside. 10 minutes prior, go sit inside, do little prayer, calm yourself, relieve your anxiousness, because now you don't require to read anymore. You have read enough. Remember that Slumdog Millionaire? Like that, you can answer any question, because we have gone through this process. We are not reading from the past 1 year. We are reading everything from past 5.5 years. So all that is somewhere restored in your brain. But that should come out. Means you should be calm and composed in the exam hall. So please stay calm, composed. Those who are going to be calm and composed can perform well. Don't think what will be the result. जो होगा सो होगा. कुछ बदलने तो नहीं वाला है. If you are tensed, इससे कुछ बदलने नहीं वाला है. Only thing वो worse हो जाएगा. So be calm. Don't think past. Don't think future. Stay in the present. When you go to the exam, be calm and happy. Finish your exam. Take little break. Start back for Neet. Right? Very good. So falloposcopy is the one which you use for looking inside the fallopian tube. Like you have laparoscope to look inside the abdomen. hysteroscope to look inside the uterus. You have falloposcope also to look inside the fallopian tube. So you can use laparoscopy and you can use HSG. We don't use X-ray. HSG में we use X-ray, but alone X-ray cannot help. HSG में X-ray with a dye, and falloposcopy also will not help. So what are the two which are helping? A and D are helping. So the answer will be A and D. What is the investigation of choice for identifying the uterine anomalies? What is the investigation of choice for uterine anomalies? It is the 3D USG or MRI. 3D USG or MRI. And what is the gold standard for diagnosing the uterine anomalies? The gold standard for diagnosing the, you can either answer 3D USG or MRI. I don't think they'll give both of them together. If they give both of them together, then it is like a very tough situation. Go with 3D USG because it is more economical compared to MRI. But if they're asking you what is better to differentiate between class 4 and class 5, then go with MRI. Okay? Gold standard is hysterolaparoscopy. Yes. One last question we'll see. A pregnant woman at 36 weeks of gestation, we didn't do any OBS question, no. A pregnant woman at 36 weeks of gestation is found to have high blood pressure and urine protein of 3+. Concomitant presence of the following symptoms would make you suspect imminent eclampsia. So what are the impending signs of eclampsia is what he is asking us. So from head to toe we'll go. First, in the head, when because of the segmental vasoconstriction and vasodilatation, what is the symptom which you have? So headache, right? Next, eyes में blurred vision, lungs में pulmonary edema, liver में the small hemorrhages of all the small vessels, when they start rupturing, they form a hematoma, and that hematoma will stretch the Glissen's capsule, and that will cause epigastric pain and oliguria. These are the impending signs. Headache, blurring of vision, epigastric pain, vomiting, oliguria. Pedal edema is not a sign of imminent eclampsia. Pedal edema is not a sign of imminent eclampsia. Okay? Alone pedal edema is not a sign, but persistent pedal edema can be taken as an imminent sign. Because we don't have another better option, so that's why we can go with the 1, 2, 3, 4. We don't have another better option, so we can go with this. Persistent pedal edema or anasarca can be also taken as a imminent eclampsia. And weight gain of 1 kg in 1 week, right? So the best answer you have here is 1, 2, 3, 4, because that will be the best answer. If I didn't have 4, I would have gone with 1, 2, 3 itself, guys. So sometimes you have to go according to the answers also. I have one more question which can be asked as an exam question. This is one more thing which I want you people to answer, you know. This is one more thing which I am suspecting can be asked again. Which of the following is not a part of active management of third stage of labor? If only 1, 2, 3 was there, I would have gone, we can go with the 1, 2, 3. But 4 is also correct in the previous question because they have given persistent pedal edema. No? That's why you can also accept the 4. Uterine massage, early cord clamping, control cord traction, uterotonics after the delivery of placenta. So the answer which is absolutely wrong here is the early cord clamping. Early cord clamping. Please remember, you never do early cord clamping. Uterine massage you can do. See, what they tell in WHO is intermittent uterine tone assessment is something which we are introduced. But if the uterus is flabby, you can do little massage, not an issue. But don't go for early cord clamping. It is now delayed cord clamping only which is done. Yes, Saurav. Excellent, Saurav. Imagine I'm again throwing a chocolate to you. Catch it. Very good. Correct. So early cord clamping should not be done. So that is why B is the correct answer. So B is something which is wrong and not a part of active management of third stage of labor. So you can remember the components of active management of third stage of labor as IDBI. So you can give uterotonic injections. You can give uterotonics injections. I means injection, that is uterotonics. D is delayed cord clamping. B is Brandt's Andrew method or controlled cord traction. Or controlled cord traction. I is intermittent uterine tone assessment. I is intermittent uterine tone assessment. If uterus is flabby, you can do uterine massage. If uterus is flabby, you can do uterine massage. There is nothing wrong. Okay, but early cord clamping though should not be done at all. Early cord clamping though should not be done at all. Manu, if I change this question in little, instead of early cord clamping, I am changing it to delayed cord clamping. Now what will be your best answer? Yes, Saurav, you are correct. Oxytocin should be given after the delivery of the baby, not after the delivery of placenta. As soon as the delivery of the baby is happening, you can give the 10 units of oxytocin IM. Yes, if the question would have been like this, then your answer would have gone for A. Okay, so depending on your options, slightly change the answers also. If the question is like this, go for B. Okay, I hope you all understood, guys. So thank you. I hope this session was beneficial to all of you. Give your exam well. All the best. Rock it and come back. And then we'll prepare well for the Neet also. Any queries which you would like to ask me before I end today's session? Oh, D, uterotonics after the delivery of placenta. Yeah, that much precise, you have to go with the options. I agree. Normally, it is after, cause of normally uterotonics should be given after the delivery of the shoulders of the baby, within 1 minute of the delivery of the baby. But after delivery of placenta, it is not something of huge mistake, right? So choose the most biggest mistake in the options. It is wrong if you don't give uterotonics at all. So after delivery of placenta also, it's okay if you are giving uterotonics after the delivery of placenta, that is still fine. But if you don't give at all, that is a mistake, no Akansha. So that is why D is fine. So इसीलिए कभी कभार ना don't go very deep into the question. That also can make you go wrong. So don't overread or don't go too deep into the questions. That can make us go wrong. Okay. So perineal tear repair. So I'm answering for all the queries in the chat box, guys. So perineal tear repair after 24 hours. Tell me one thing. Perineum is a dirty place or not? Fecal matter and all. So after 24 hours, you require some that fecal matter to get diverted. You want the edema, everything to subside. So it will take some time, no? So perineal tears detected after 24 hours, repair after 3 months. repair after 3 months. So guys, maneuvers, you can just know the names of the breech ka maneuvers, shoulder dystocia ka maneuvers. It is not like very commonly asked, but just know the names. Okay. Cervical cancer, Mullerian abnormalities, contraception के contraindications, IUCD के contraindication, OCP के contraindication. These are something very, very important and can be asked. Okay. Sure, Padma. I'll be definitely doing some more MCQ sessions as already announced. 9, 10, 11 at 9 p.m. We'll have some more practice sessions to discuss and become perfect with the obstetrics and gynecology. So thank you guys. All the best. Keep studying. All my prayers with you all. Just rock your exam and come back. Thank you guys. Yes, yes, Saurabh. If perineal tear has been not repaired within 24 hours, if you have detected it after 24 hours, then repair it after 3 to 6 months. Okay. If you have the option of 3 months, go with 3 months itself. Not after weeks, after 3 months. Okay.